Hi, it's Christina with the Sisyphean Journal. Today is April 25th, and we are going to look at the third dead patient I know of for a very reputable abortion doctor. 22-year-old Nichole was the third patient that I know of to have died from a safe and legal abortion after the dubious care of Dr. Robert Crist. The others were Latache Vial and Diane Boyd. Latache has the honor of being somebody whose death was discussed at a National Abortion Federation meeting attended by staff from the Centers for Disease Control Abortion Surveillance Branch, but they didn't bother to report it because they reported 0 deaths in Latache's race and age range. And Diane Boyd, who was an intellectually disabled rape victim, and Chris gave her drugs that interacted with her meds that he had been told she takes, and he gave her these meds anyway. Now, Nichole was a mother of 3 children, ages 7, 3, and 1. She lived with her boyfriend and died after an abortion at Reproductive Health Services run by Planned Parenthood in St. Louis, Missouri. And by the way, Crist and this Planned Parenthood, if you're an old fart like me, you may remember the Dean Alberti. Right now it's been David Daleiden who's been exposing the Planned Parenthood fetal parts trafficking. The first person to break that was Dean Alberti, and that was at this Planned Parenthood with Crist. Now, some of the cost of Nichole's $550 abortion came from a national foundation which Planned Parenthood refused to name. Probably because it's highly unlikely that their donors would keep donating if they were donating to get the women killed. So Chris started the first trimester abortion at 2 p.m. on Friday, April 25th, 1997, administering lidocaine and vasopressin for a procedure expected to last about 5 minutes. But seconds before finishing the abortion, he noticed that Nichole had breathing problems, finished the abortion, and then instructed staff to call 911. I think he should have told staff to call 911 while finishing the abortion. Your mouth and your hands can work at the same time. The 911 transcript indicates that Nichole was having difficulty breathing and was conscious but not alert. Now, the staff began resuscitation, but Nichole was in full cardiac arrest by the time medics arrived 15 minutes later. Efforts to revive her continued in the ambulance and at Barnes Jewish Hospital, but to no avail, and she was pronounced dead at 3:12 p.m. Now, there were questions raised about why it took so long for an ambulance to arrive, and that the ambulance crew spent 20 minutes trying to revive her instead of load and go. And it also somehow took the medics 3 minutes to get to the patient after arriving at the facility. And interestingly, Reproductive Health Services wound up with a private ambulance that was only used as a backup when city ambulance wasn't available, so that might have been a factor. Now, Nichole's death was officially attributed to disseminated intravascular coagulopathy, say that 3 times fast, a clotting disorder that can be triggered by trauma, illness, or foreign material in the bloodstream, which in this case would likely be fetal tissue or amniotic fluid. Nichole's is the only case I've ever read of linking disseminated intravascular coagulopathy with first trimester abortion, and pro-lifers expressed skepticism about the report of DIC, saying they believe her uterus was punctured. So, Reproductive Health Services was a National Abortion Federation member facility, cream of the crop, run by Planned Parenthood. So, 2 dead patients there. Chris' other dead patient was in Texas. They claim that they follow the highest standards, but it's a little dubious when you think that Dr. Abu, the butcher of Avenue A, Hyatt, was an active member when he performed the abortion that killed Sophie McCoy, and when he ripped the arm off a 32-week Ana Rosa Rodriguez in an abortion attempt. Other dubious NAF members include Family Planning Associates Medical Group, a chain that has, I've lost count, I think it's 16 dead patients. And, of course, the famous Abraham Alberto Hodari, whose Detroit clinic is responsible for at least 3 abortion deaths, including an illegal 3rd trimester abortion performed on an underage girl at the behest of her abuser's sister. And Crist was the medical director of reproductive health services. And by the way, there was another death blamed on them. A 14-year-old girl committed suicide after a 1984 abortion performed there without her mother's knowledge or consent. So, cream of the crop, 3 dead women, and then a suicidal teenager. That's what you get.